Most people believe high blood pressure comes with warning signs: headaches, dizziness, a sense that something is off inside the body. And because of that belief, millions of people walk around every single day feeling completely fine, assuming they are safe, assuming nothing serious could possibly be happening inside them. But what if that assumption is completely wrong? What if the most dangerous form of high blood pressure gives you absolutely no warning at all? No pain, no discomfort, no signal that anything is going wrong. What if it doesn't strike when you are awake, but instead quietly builds while you are asleep, in the one place you feel safest, in your own bed, with no awareness, no control, and no chance to react? I've spent decades inside operating rooms. I've seen the inside of arteries that look normal from the outside, but were silently deteriorating within. I've opened the chest of patients who were laughing with their families just days earlier. People who felt healthy, active, completely normal, and yet within a matter of hours their lives changed forever. No warning, no dramatic buildup, just a sudden event that no one saw coming. And in more cases than most people realize, the damage didn't begin during the day. It built quietly at night. Think about how blood pressure is usually measured. You walk into a clinic, you sit down, a cuff is wrapped around your arm. 30 seconds later, you are given a number. Maybe it's normal, maybe it's slightly elevated. Either way, that single reading becomes the foundation for your entire treatment plan. 30 seconds out of an entire day of 86,400 seconds. That tiny snapshot becomes your medical reality. But what about the other 86,370 seconds? What about the hours when you are not sitting calmly in a chair? When your body is doing something far more complex than resting quietly under observation? And more importantly, what about the 8 hours when you are asleep? When your body is supposed to be repairing itself, resetting its systems, and preparing you for another day? Because that's where something critical happens, something most people have never even heard of, and something that changes dramatically as we age. Under normal conditions, your body follows a rhythm. During the night, your blood pressure naturally drops by about 10 to 20%. This is not optional. This is not a minor adjustment. This is a critical biological process known as dipping. During this period, your heart gets a chance to recover from the constant workload of the day. Your blood vessels relax. Your kidneys process waste more efficiently. Your entire cardiovascular system enters a state of repair and maintenance. It is one of the most important cycles your body performs every single day. But after the age of 60, this system begins to change. Your arteries gradually lose their elasticity. They become stiffer, less responsive, less capable of adapting to the body's natural rhythms. At the same time, your autonomic nervous system, the system responsible for regulating involuntary functions like heart rate and blood pressure, starts to lose its precision. The signals that once guided that nighttime drop become weaker, less consistent, less reliable. For millions of people, that natural drop simply stops happening. Instead of decreasing, their blood pressure stays elevated throughout the night, or in some cases, it rises even higher than during the day. And here's the most dangerous part. They feel absolutely nothing. No warning, no discomfort, no sign that anything is wrong. They go to sleep thinking everything is fine. And they wake up assuming they just didn't sleep well, maybe feeling slightly tired or foggy, brushing it off as aging, stress, or a poor night's rest. But the reality is far more serious. Their cardiovascular system is under continuous strain for hours, night after night, without interruption. This pattern has a name. It's called being a non-dipper. And more than half of adults over the age of 65 fall into this category. Not a small group, not a rare condition, the majority. And the consequences are not small either. People who are non-dippers have a cardiovascular risk that is 3 times higher than those whose blood pressure follows a normal nighttime pattern, even if their daytime readings look perfectly fine. The same numbers at the doctor's office, the same medications, the same lifestyle, but a completely different outcome. And then there is an even more dangerous group known as reverse dippers, individuals whose blood pressure actually rises during sleep. For them, the risk of stroke increases 4 to 5 times. And yet, if you were to measure their blood pressure during a routine office visit, you might never suspect anything unusual. Everything would appear normal. That is the gap. That is the hidden risk that goes undetected in millions of people. I remember one patient very clearly. During the day, his blood pressure was nearly perfect. 120/78. exactly what you would want to see. No red flags, no cause for concern. But when we placed him on a 24-hour monitor, something entirely different appeared. Around 2 in the morning, while he was in deep sleep, his blood pressure spiked to 164/102. That is not a mild elevation. That is a level associated with immediate risk. And he had no idea it was happening. He slept through it. Night after night, his body was experiencing these surges, placing stress on his arteries, his heart, his kidneys, without any awareness, without any intervention. So what causes this? Why does the body behave this way? There are several factors, and many of them are far more common than people realize. One of the most overlooked is medication timing. Most blood pressure medications are taken in the morning. That has become the standard routine. But these medications do not last indefinitely. Their effects peak within a few hours and then gradually decline. By the time midnight arrives, their protective effect may be significantly reduced, precisely when the body needs it the most. Another factor is the disruption of natural hormone cycles. Cortisol and adrenaline, which are supposed to decrease at night, may instead remain elevated or even spike, keeping the body in a state of alertness when it should be resting. And then there is sleep itself. Fragmented sleep, even brief awakenings that you do not remember, can trigger a stress response, causing sudden increases in blood pressure multiple times throughout the night. There are also hidden contributors in everyday life, things that seem harmless, even healthy. Take licorice root, for example. It is commonly found in herbal teas and natural remedies, often marketed as soothing and beneficial. But licorice contains compounds that interfere with enzymes in the body, leading to increased cortisol levels. Elevated cortisol at night can drive blood pressure upward, creating exactly the kind of environment we want to avoid. Then there is alcohol, particularly in the evening. While it may help you fall asleep initially, its effects do not end there. A few hours later, as your body metabolizes the alcohol, a rebound effect occurs. Your nervous system becomes more active. Stress hormones rise. Blood pressure can surge, often reaching its highest point in the early hours of the morning. And grapefruit juice, which many people consider a healthy choice, can interfere with the way certain medications are processed, leading to unpredictable and sometimes dangerous levels in the bloodstream. The question then becomes, how do you actually detect what is happening during those critical hours? The answer is surprisingly simple, yet rarely used. It's called ambulatory blood pressure monitoring, or ABPM. This involves wearing a device that measures your blood pressure at regular intervals over a full 24-hour period, including while you sleep. It provides a complete picture, not just a snapshot. It reveals patterns, fluctuations, and abnormalities that would otherwise remain hidden. Despite its value, most people have never undergone this test. It is not routinely offered. It is rarely suggested unless specifically requested. There are also early warning markers that can indicate damage before it becomes severe. Microalbumin testing, for instance, can detect tiny amounts of protein in the urine, a sign that the kidneys are under stress. Oxidized LDL, a modified form of cholesterol, reflects damage occurring within the arterial walls. These markers provide insight into processes that are otherwise invisible, allowing for earlier intervention and better outcomes. Solutions do exist, and some of them are remarkably simple. Adjusting the timing of medication under medical guidance can align its peak effect with the hours of greatest risk. Incorporating certain natural compounds, such as properly prepared hibiscus tea, may offer additional support through mechanisms that are already well understood in medical science. But perhaps the most important step is awareness. Understanding that what happens at night matters just as much, if not more, than what happens during the day. Your heart does not take a break when you go to sleep. It continues to work, continuously, consistently, every second of every hour. And for many people, the most significant strain occurs when they are completely unaware of it. That is why this information matters. Not as a source of fear, but as a tool for prevention. Because in many cases, the difference between a healthy future and a serious event comes down to one simple factor: whether or not the problem was detected in time. If you take nothing else from this, remember this. Feeling fine does not always mean being fine. A normal reading during the day does not guarantee safety at night, and the absence of symptoms does not mean the absence of risk. Ask the right questions, request the right tests. Pay attention to what your body is doing when you are not watching. Because sometimes, the most important signals are the ones you never feel at all.